Go.
Good morning, boys and girls. How are you doing today?
Good.
Great. My name is Armando, and I'm from Toro University. And today we were invited to come to your school to do some lessons on oral health. So we have some really fun activities. We're gonna make soda, orange soda. For those of you who likes orange soda. Okay, so we're gonna make orange soda. Awesome. We're gonna teach you how to brush your teeth. We're going to talk about cavities. We're going to talk about sugar. And then at the end, we're going to give you awesome goodies to take home. How does that sound?
Great.
Awesome. Okay, the first thing I want to talk about is sugar. Obviously, sugar, we all have it, either in food or drinks. But sugar is actually not that good for you in large amounts. So, sugar, in the mouth, it creates an acid, and this acid actually changes the environment of your mouth. And if of course this acid is around your teeth, it's going to create tooth decay. And tooth decay pretty much is a hole in your teeth. Okay, so we don't want holes in our teeth, right? So I'm going to show you some pictures of what that tooth decay looks like. Okay? What do you think about that?
Gross.
Gross, right? So this is actually some examples of some tooth decay. I'll show you an example of what good teeth should look like, healthy teeth. Okay? This is how healthy teeth should look like. Nice, pink, or very firm gums. Very healthy teeth, okay? Well, let me show you another picture, and if you tell me if you think it's a healthy mouth. One second. What do you think of these teeth? Do they look healthy? It's a 3-year-old. What do you think?
Mm-hmm.
They look healthy. Well, apparently they do look healthy, but if this kid opens his mouth or her mouth, this is what's inside. This is a 3-year-old already having all these cavities, tooth decay. Okay, so we don't want that. So let me move forward. Now, we're gonna analyze the foods, the contents of sodas. Okay, who likes soda? Raise your hand if you like soda. All of you, obviously. Raise your hand if you drink at least 1 soda a day. Okay, that girl. Okay, what about if you drink 2 sodas a day? Wow. 2 to 3 sodas a week? Wow. Okay. Why does soda give you such a quick energy? When you drink soda, you have so much energy. Why is that? The girl with the scarf?
I don't know.
Well, the reason this soda gives you a rush, what they call it, it's because of all the sugar in soda. But what happens is after this rush wears down, you feel really tired, you feel groggy, okay? So it's almost, it doesn't last. The sugar rush doesn't really last, okay? So now we're going to make some soda. So this is going to be interesting. I'm going to need sugar, obviously, because there's a lot of sugar in soda, okay? I have 3 jars here, only because I'm going to use them at different stages. And we're going to make an orange soda. I'm going to move these over here so that you guys could have a better look at what I'm doing. Okay? And then we need carbonated water. Okay? Carbonated water is soda water, or sometimes they call them club soda, but pretty much is the same thing. What's actually in here is carbonic acid, and this acid is actually bad for your teeth as well. So, not that good. And then we have some food coloring, orange food coloring, okay? So, first, we're going to see, since this is anybody drink this before? Okay, guess how many ounces are here? There's actually 12 ounces. So we're going to make exactly the same amount of soda. So I'm going to see how much I'm actually going to need, okay? We're going to pour it in here. Okay, so that's that. So now, I knew that was going to happen. So obviously, I'm glad that happened actually. What you saw there was the carbon dioxide that's actually inside the water. It's the salt which makes all these bubbles, which is not really good for you. Okay? So we're going to pour the same amount of carbon soda or club soda as the can. Is that about right?
Mm-hmm.
What do you think? A little more? And we're all paying attention? Great! Okay, I'm going to put this over here. And then we're going to add some color. So you tell me how much coloring should I put? And this is actually what's in the soda that you drink. How much coloring should I put so it could match the color of the soda? Does it match? Should I put more? How about now? Does it match? How about now? A little more? I think that's about right. What do you think? Okay, I'll add a little more just to be safe. Okay? So, this is the fun part. We're gonna add sugar, and you're gonna tell me how many teaspoons. This is a teaspoon of sugar. Okay? How many teaspoons of sugar there is actually in this can of soda? So I'm gonna add one, and then the other, and then the other. You tell me when to stop. Okay? So here's the first one. One. Should I continue? So you're gonna tell me when you guess you think it's the what's actually inside here. 2, 3. Stop me anytime. 4, 5, 6. Anyone?
I think that's enough.
There's actually more. 7, 8, 9. All this sugar you're actually drinking every time you have a soda. And 10. This, whoever guessed 10 is correct. Okay, this little can of soda has 10 teaspoons of sugar. So I'm going to try to dissolve it because right now it's just sitting at the bottom right there. Okay? So I'm going to dissolve it. Try at least. And it doesn't really dissolve completely. You can still see it at the bottom. So next time you drink soda, this is actually what you're drinking. Okay? Should I taste it? No, right? So does it look pretty much the same?
No. Not at all.
So don't ask that question. Well, you know, we get the idea. I'm pretty sure there's other ingredients there that that we didn't add. But the basic ingredients, the carbonated water, the sugar, and the food coloring is what makes soda. This is what you're drinking every time. Okay? Now, I'm going to pass out a worksheet, and I want you to circle your favorite soda that you like. Okay? And when you're done, see on top here, we have different kinds of sodas. And we have a 7-Up, Sunkist, just what we did here, root beer, Coke, Dr. Pepper, and Mountain Dew. Circle the one that you like, and then we're going to figure out how many grams of sugar are in each of these sodas. Okay? So, young lady, which one did you circle?
Root beer.
Root beer. Okay, so find root beer on the little box here. How many grams of sugar does root beer have?
45.
45. So the trick is you divide, and you all know how to divide, of course. You're going to divide by 4. So 45 by 4, and that's how many teaspoons of sugar are in that root beer. So I'll give you a few minutes to figure out your math. And when you're done, raise your hand. And then you could share with us.
This is kind of complicated math. It doesn't go evenly.
Oh, okay, and that's okay. So let's do it on the board. So 45, right, divided by 4, right? So how many times does 4 go into 4?
1.
So that's 4. Subtract, so then that's 0. You bring down the 5, okay? How many times does 4 go into 5?
1.
1, okay. 1 times 4 is 4. Okay, you subtract again. Then you have 1, okay? So you have a remainder. And we've done decimals, right? So we're going to add a decimal here, and we're going to bring a 0 down here, okay? So, and this becomes 10. How many times does 4 go into 10?
2.
2. Very good. So that's going to be 8. Okay, and I'm going to continue here, just so that we have room. So subtract, so that's 2, right? So then we could bring another 0 down, and I'll bring it here. Okay, so now how many times is 4 going to 20?
5.
5, excellent. So that's 20, 0, perfect. So your answer, Ruby, is 11.25, which is 1/4. So you would have 11 more than the actual Sunkiss, actually. So did you know you were drinking that much sugar in each drink each time?
No.
Are you gonna? Can you wait till you drink your next root beer, or should you have another alternatives? What are other alternatives to drinking soft drinks? Can you raise your hand and tell me what's a healthy drink to as an alternative to soda?
Lemonade.
I'm glad you brought that up. Lemonade has a lot of sugar unless you make it at home and you don't add sugar. But we actually have a lemonade here, and I'm going to show you the content of a sugar content in a little bit. What else? What other drinks are good? The number one drink that's the best for your body.
Water.
Water, excellent. What's another one that's really good for you? Helps you grow, helps your teeth, helps your bones. It's white.
I don't know.
Cows make it.
Oh, milk.
Milk, absolutely. So milk and water are the best things your body wants, okay? So, let's move on. Okay, now I'm going to show you a picture of, I'm going to show you how to read, since a lot of us might not know how much sugar is in each of these cans. I'm going to pass out this is called a nutrition facts label, and I'm going to pass this out to Ruby and give one to all your classmates. So what this is just a big picture of what's in the back of every soda can, in this case a Sunkiss, okay? And I wrote it down here for all of us to discuss and see what it is they were reading. So of course it's called Nutrition Facts, and the first line, can you read there, Ruby, for me? What does it say? How many calories does it have?
170.
Okay, and then the other student, Mary, what does the next line say?
Total fat.
Total fat.
0G.
0G, okay. And then the next number that we have, that's a polyunsaturated, and those are fats as well, and monosaturated fats, so 0. Who can find how many grams of sugar in this list?
How is there no fat in 40 grams of polyunsaturated fat?
I'm not sure. Again, but that's a good question. But let's concentrate right now on the sugar, and then we'll come back to that. How's that?
Okay.
Okay, good. So, Stephanie, can you show me where how many grams of sugar and where it is for the class?
Down here.
Down here. And how many does it say?
43.
43. So, can we do the math for 43, which is close, very close to Ruby's root beer, right? So it's 43, 1 into 3, you have 13 left, bring the 3, then you have, then you have 0 here, wait, sorry, 1, I cannot today. 1, 3, and then 13. Yeah, there we go. Oh, no wonder. It's because I'm using a 4. I apologize. Okay, let me start all over. Okay, so it's 43 divided by 4. So that's 1. Okay, 0, bring the 3. That's 0. Okay, you put a decimal point. Then you have 30. 28. So 10.7, which is what we did earlier with the math. Okay. So from now on, we have to be very careful. And if you do want to drink or have a soft drink, make sure it has a low sugar content. Okay. So now we know how to read a label. What about other foods that have sugar? Does everyone like? Can you name some foods that might have sugar that you eat at home or in school?
Candy.
Candy, absolutely. What about another one that's not that obvious? Does salad have sugar?
Dressings might.
Dressings might, but what about just tomatoes and lettuce? Would that have sugar?
Fruits have sugar in them.
Okay, that's sugar, but not added sugar, right? That's a natural sugar.
Right.
What about this? Who likes Lucky Charms? Okay, so we're going to talk about Lucky Charms and see if Lucky Charms has sugar, okay? So, Mary, since you're very good at reading labels, can you show me, find where the sugar is, and then tell me, raise your hand when you find it?
Oh, it's here. Under carbohydrates.
And how many grams?
13.
13. And how many teaspoons is that? Let's do the math. So 13 grams divided by what?
4.
4. Very good. How many times does 4 go into 13?
4.
4? How about 3?
Yeah.
Okay, 3. So that's 12. You have 1. Okay. Add a decimal point. Bring it down. How many times does 4 go into 10?
2.
2. So that's 8. Sorry. Then you have 20. Bring another 0. And 4 into 20?
5.
5. Okay. So 3.25 grams of sugar. So every time you eat Lucky Charms, okay, you're going to have 3.25 teaspoons of sugar. But, serving size is actually 1 cup. Okay, if you have 2 cups, 2 cups of cereal, how much sugar are you going to have?
6.5. There.
6.5, right? So there you go. Every time you eat something now that's packaged or has a label, make sure you know how to read and say, if you find a different, item or a different soft drink, different food that has less sugar, go ahead and pick that. Okay? Why do we want to avoid sugar again? Who's my super lucky super student here? Why do we want to avoid sugar? What do we want to do?
Because it puts holes in your teeth.
Because it puts holes in your teeth. Absolutely. When you go to the dentist actually fills your teeth with a filling. Who has visited the dentist here before? Very, very good. Okay? And that's what a filling is. And it restores your tooth to its normal shape so that you have a healthy mouth. Okay? Now, who's having fun so far? Excellent. So now, when you have let's say you do have sugar, you have a soft drink, you have a candy. What are some of the things that you could do to get rid of that sugar that's in your mouth?
Brush your teeth.
Brush your teeth. What if you don't have a toothbrush right away, and you're in school? What can you do?
Don't know.
Anyone else? How about Maria in the back? Yes, you, Maria.
I don't know.
Is there water in school?
Yeah.
Can you rinse your mouth with water, at least?
Yeah.
Okay, excellent. Can you bring your toothbrush to school if you wanted to, in a little toothbrush container, and brush your teeth?
Embarrassing.
But you're in the bathroom. What if all your friends brush your teeth? Would that be embarrassing?
No.
There you go. Okay. Finally, I'm going to give you all this it's called Rethink Your Drink, and what it's saying is we're going to think twice before you actually drink a soft drink. So I'm going to give you all a little card, but so I'm going to pass them out, and I want you to find, so here you go, I want you to find the soft drink with the highest sugar content, with the highest grams of sugar. And then raise your hand when you find it. Okay, Estefania.
Mountain Dew.
Mountain Dew. How many grams of sugar?
19 teaspoons.
19 teaspoons. 19 teaspoons of sugar. Okay? What about the other ones? What's the next highest?
Coke has 17.
Okay. So, so far, based on what I've taught you about soft drinks, sugar, and labels, who here is going to think twice before drinking something that has so much sugar?
But it tastes good.
Absolutely. It does taste good, but should you have it so often?
No.
Okay. So, something to think about. It doesn't have to be an immediate change right away. Just let's start thinking about it. Let's start talking about different options. Okay? So now, I'm going to actually show you how to brush your teeth. Okay? We have here, this is called a typodont. How are you doing? And these are all our teeth, obviously. How many teeth do we have in our mouth for just like a super duper smart guy?
100.
Or girl? Not that many.
Oh.
It's below 40. Anyone else? You in the back that's raising your hand.
40.
Jackie. It's actually 32.
Oh.
Okay, so I have a big toothbrush here. I'm going to show you how to brush your teeth. Raise your hand if you think you know how to brush your teeth. Okay? Tell me if you know how many minutes you should brush your teeth every time you do. Is it 30 seconds, 1 minute, 2 minutes?
As long as it takes to sing happy birthday.
As long as it takes the same time of birthday. I like that. I like that. So, very good. I haven't heard of that one. Very good. Okay, so I'm going to teach you all, okay? So, this is actually the bottom. This is the top. So, we're going to start with the top, okay? And in the back here. So, I want you to do circular motions this way. Okay, we're going to do, and then count to 5. 1, 2, 3, 4, 5. And then here in the corner, 1, 2, 3, 4, 5. In the front, 1, 2, 3, 4, 5. Corner, 1, 2, 3, 4, 5. Back, 1, 2, 3, 4, 5. And then the chewing surfaces, okay, on the back of your teeth, 1, 2, 3, 4, 5. Same corner, 1, 2, 3, 4, 5. And then here, you're going to go this way, 1, 2, 3, 4, 5. Corner, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And then immediately, you're going to go under, okay? A lot of folks, we don't brush enough on the other side, okay? They get just as dirty or sometimes more because a lot of food accumulates there, okay? So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And then the bottom, okay? Same thing. 5. 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. What's next? Who's not paying attention? Miss Maria, you need to pay attention here. Then the surfaces of your teeth. 1, 2, 3, 4, 5. Corner, surface, 1, 2, 3, 4, 5. Okay. The back of your teeth, 1, 2, 3, 4, 5. Corner, okay. 1, 2, 3, 4, 5. And then inside you just twist. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And 1, 2, 3, 4, 5. What's one last place we need to brush?
Your tongue?
Your tongue. Okay? And you just scrape it. 1, 2, 3, 4, 5. Okay? A lot of germs actually accumulate on your tongue. Okay? So, after you brush, are you done? Are you done after you brush?
You need to floss.
You need to floss. Raise your hand here if you floss. Okay, very good. So I'm going to teach you how to floss. So, these are your teeth. Okay? And this is your dental floss. You don't have to use this. Okay? You could also use one of those plastic flossers, okay? And I'll show you with both. Okay. Before you leave today, I'm going to give you all like toothbrush, floss, and both kinds of floss actually, so that you have no excuse not to floss. Okay. So the biggest mistake that a lot of folks do when they floss is they just think that by putting the thread between their teeth, that's enough. Okay? It's actually not enough. So you have to hug the tooth. I'm going to lean here so I can hug the tooth here and then go up and down. Okay? Same with the other side. Hug the tooth and then go up and down. Okay? Same on the side. Hug the tooth, go up and down. Okay? So it's not enough just to do that. Okay? And with the plastic flossers, you do the same thing. You bring it in, and then they break. No, let's say it didn't break. So you just hug it on both sides. Okay? So, any questions about flossing? Any questions about toothbrush? Okay? Who here doesn't have a toothbrush? Obviously, we all have a toothbrush, right? Raise your hand if you've been to our clinic here that's in your school. Okay? So, raise your hand if you've never visited the clinic here in school. Why not?
I have another dentist.
Okay, and that's okay. As long as you have another dentist, that is absolutely okay. But if you don't have a dentist, our services here are 100% free, and I'm going to give you a flyer to actually help you know where it is, and so you can make an appointment. Okay. I'm also going to give you a take-home instructions on how to brush your teeth the same way that I just showed you, and it's in Spanish and English. Okay, I'm going to take that. I'll give that to your teacher, and then I have a how to floss sheet, both in Spanish and English, and I'll give that to your teacher as well. Okay. Earlier, I was going to do a survey at the beginning, but now I'm going to do it at the end. Sorry. So I'm going to pass this around and do a survey, but we should have done this at the beginning. So I'm going to raise your hand if you know what a survey is. What's a survey?
Ask questions.
Ask questions. Okay, so we have several questions here, and so we're going to go through the survey one question at a time. So the first thing that I want you to do is put your grade level there. So this is 5th grade, so put 5. And then you put your age. You should be what? 11, 12?
I'm 26.
And then put if you're a boy or girl. Mark if you're a boy or girl. And then for your primary language, you should put either English, Spanish, or other. And we should have the words there, and then you could just circle them. Okay? And then going back here to the first question, question A, it says here, the condition of my teeth is an important part of my overall health. So do you agree with that? So you either strongly agree, somewhat disagree, or strongly disagree. So mark 1. Okay? Don't mark all of them, young lady. We're going to do them one at a time. Okay? So the next question is, everybody got it? Okay, good. We're going to raise your hand if everyone's done. Excellent. The next question is, tooth loss is part of getting older. So losing your teeth is part of losing older. Do you agree or disagree, or one in between? So go ahead and mark that. Okay, everyone's done? The next question is it important to keep your natural teeth? Okay, is it important to keep your natural teeth? What are natural teeth, Ruby?
The ones in your mouth.
The ones in your mouth. What about when you go to the dentist and they give you a fake tooth? Is that a natural tooth?
No.
No, okay. So the next question is, it's important to brush your teeth at least once a day. Do you agree, disagree? Somewhat agree, somewhat disagree? Okay. Next question is, dental visits are only important if you have dental emergencies. What's a dental emergency, Maria?
When your mouth hurts.
When your mouth hurts. What's another dental emergency, Lupe?
Your teeth fall out.
Your teeth fall out. Okay. Any of those are emergencies. Good. The next question. Regular checkups will help prevent dental problems. What's a regular checkup? Ruby?
I don't know.
Well, it's okay not to know. Regular checkups is when you go to the dentist, who's a doctor, regularly. And regularly means every 6 months. Okay? Dental visits cause pain. So does it hurt every time you go to the dentist? Let's see, who raised their hand that has gone to the dentist? Stephanie, you raised your hand.
Mm-hmm.
Does it hurt when you go to the dentist?
Sometimes.
Sometimes. Does it always hurt?
No.
Okay, but it's not the end of the world, right?
Mm-mm.
Okay. The next set of questions we're going to do are true or false. Okay? So, for instance, the first question is, it is important to always use a soft toothbrush. So, here we have a toothbrush, and we call soft the brittles here. We call them soft when they're soft, or when they're really hard, we call them hard. Okay, so do you think it's true or false? So mark that. The next question is, you should brush your teeth for 2 minutes per day. 2 minutes per day. And then earlier you said happy birthday song, so how long does that last, right? Next question is, juice and soda can cause tooth decay. We all know the answer to that. Water is the best drink for your teeth and body. Okay. Fluoride is a mineral that makes your teeth strong. Flossing daily helps prevent gum disease. Eating healthy is important for healthy teeth. Okay. Next question is, so you're gonna choose one of the bubbles here that you have as options. So the first question on this page is, dentists recommend that you brush your teeth and then mark one of the options. Okay. Next question, does sugar contribute to cavities? So mark your answer. Next question, gingivitis is, so if you don't know what gingivitis is, just try to guess what it is. But if you do know, just mark it as well. The next question is, the 2 most important dental health habits are, so mark that. And then, changing the page, plaque is a sticky film of bacteria that is colorless, brown, green, none of the above. Okay, next question. The reason we brush our teeth is to remove bacteria from teeth surfaces, or to remove food particles from food surfaces, all of the above, or none of the above. Okay. Next, have you ever visited the dentist before? And I think I asked that, so for those of you who said yes, mark yes. For those of you who said no, mark no. And where is your dentist? Is it here on campus, on school, or is it somewhere else? So mark that. How many sugary drinks do you have per week? None, 1 to 2, 3 to 4, or 5 or more. So mark that. And then when you're done, just pass them down. Don't put your name on it or anything. So just go ahead and pass it down to me, and I'll take that from you, Ruby, and all your students. Okay, very good. Now, I just want to thank you for letting me come to your classroom and show you all these important facts about brushing and making soda in front of you guys. Are there any questions that you have before I leave? We're going to give you all goodie bags, but do you have any questions before I leave? No? Okay, well, thank you so much. I should have done this before. It's useless without...
Yeah.